Morning, everybody. I'm going to call to order the October 24th meeting of the Special Committee on Academic Health. Thank you to everybody who's joining us in this West Committee room. While today's meeting is not being live streamed, it will be available on the board's YouTube channel after the meeting. Just a quick reminder that this committee room has room-wide microphones, so make sure you're projecting while you speak, and please, I'll ask the audience to hold side conversations, limit those. So we have two items for today. One is a review, again, of the Health Sciences Strategic Plan. As you recall, that was one thing that was really one of the primary recommendations from the governor's task force, is that the interprofessional nature of our school, one of the rare ones that has 6 professional schools, how are we going to do that, effectively? And the deans have been working exceptionally well with a lot of stakeholder involvement on that plan, and so we'll review that. We reviewed a draft plan at the September meeting, and today's presentation will highlight the stakeholder outreach that we talked about, which is ongoing and occurring, as well as the government advocacy plan for the 2025 Minnesota legislative session. So we're fortunate to have Melissa Lopez-Franzen for that part here as well. Our discussion will provide the special committee with a final opportunity to offer feedback on this strategic plan. That input, along with any other additional stakeholder feedback, will inform the final plan, which will return in December for final approval. With that, I will turn to hear Vice President Toller and Executive Director of Government and Community Relationships, Melissa Lopez-Franzen. Vice President Toller, would you like to start?
Yes, ma'am. Chair Wheeler, Regents, Madam President, it's a delight always to come back to this group, of course, and continue in the discussion of the Health Science Strategic Plan. Now, you will remember that last time we have set up the goals and strategies, and today we are here to briefly update you on where we are with the feedback that we have gotten from the engagement with the stakeholders, and with Melissa's help in a minute. We will use that ideas and energy for the formulation of the legislative ask. So for the framing first, the vision of this whole effort is that we will have not just the best healthcare in the union in the state of Minnesota, but rather that we will also advance this as the nation's healthiest state, because healthcare and health are not necessarily synonymous. They are similar, but not synonymous. The mission is to foster this healthier Minnesota through innovation, through partnerships, through education, through things that we are doing day in and day out. And these are the real superpowers of the university, such as ours. When we come to this, I think it's an important thing to frame it in a way of the challenges that we face. We all know about the aging, not just aging of the population. I mentioned last time that we will soon have more people in the state of Minnesota that are older than 65 than younger than 18. It's also the aging of the workforce. 1 in 3 healthcare professionals in the state will retire in the next 5 years. So we are facing that. We are facing financial difficulties everywhere. All the healthcare systems that we collaborate with, all the players in the ecosystem of healthcare in the state of Minnesota are at enormous financial pressure. The healthcare deserts, there are whole regions of the state that actually don't have not just the primary care, but the specialized care that they need to care for their people. So the university, and that's the punchline, is uniquely positioned to provide solutions for the state, and that's what, in this collaboration with organizations, that's what we are here to do. On this slide, you can see that we have focused on 4 different strategies. We are expanding access, that's always important, by reducing the healthcare workforce shortages, as I indicated. We are working to reduce the inequities by expanding the partnerships and working with the communities. We are improving the care, the quality of the care closer to home, because nobody wants to travel across 2-3 hours to the hospital to be taken care there. And finally, to transform the health outcome through innovation, again, our superpowers, prevention, treatment, and care models. Next slide. The very good advice of this board has been to engage the stakeholders. So we are always following the direction of this board, of course, and we have gained an enormous number of ideas, understanding of what is the value that the university actually presents to the state of Minnesota, and how we can build the relationships and the support. Because in any leadership position, as we all know, it's really important to look behind you if the people are actually following what you are trying to lead. So we have done this in a number of ways. The first phase was the internal one. We talked to the deans of the health science schools. Thank you for being here today. To faculty, to the leaders on the system level of different campuses that we have at the University of Minnesota. And we got advice that it's important to catalog what we have. That's pretty obvious. That we need to increase our activity in rural and underserved areas of the state, and that we should include more innovation in how we look at these challenges. And we have adjusted, according to this internal feedback, the version that you have seen already. Now, next, we have engaged the firm of Thunheim and to do the deeper dive in understanding what's happening at the healthcare system level, what's happening around the state, and what is the university's role as the people that we are trying to serve and lead. What is the value of the university and the role of the university in that ecosystem that I described? And we also ask, is this strategic plan any good? Is this something that people can get behind? And what we have learned is that, and that's a good thing, that the university is essential player in the ecosystem of healthcare. Then we learned that the university is the player that should convene other partners in the ecosystem, and also that we need to, as some of you have shared with us before, we should be better in storytelling and in getting people to understand better how university works and how would it work with and without additional funding that we will be asking the state. From the task force, thank you, Chair Wheeler, for mentioning it. From the task force, we have learned that they would like regular feedback updates from us. They would like more public health, more occupational health, more engagement with the community, more industry partnerships, and more, remarkably, but understandably, help in the dental professionals shortages. Now, I have been, as is seen on the map, I've been traveling, so I've been to a number of places like Winona, Alexandria, Hutchinson, Wadena, you just mentioned that, Sleepy Eye, Glencoe, Roseau, that's very far, and it's a really small plane. I'm not a fan of these very little planes, but anyway. What I learned is that with my team that the number one desire of these independent players typically is more training in the rural areas, which is exactly where we are. And that's where, a second part of this presentation will be on the Duluth. Then that there are access gaps. These are the deserts that I mentioned. And then it's humbling, how often, like every single time I heard, this is the first time we have ever seen a dean of medical school here. And these are people who live there for decades. So just the gesture of coming and being face-to-face, voice-to-voice, has been transformative. And we all sort of know that, But I was surprised and humbled. Next slide. Now, in general, we would say that the more focus on research as it is engaged with the communities, more rural health, more collaboration across all of the verticals and horizontals that you can imagine is absolutely foundational. And the common denominator, as I said, is the engagement with the community and the storytelling. The storytelling, as you have said many times, is so important for who we are and how we serve the state. Next slide. Now, you asked for understandably, for some detail at the last meeting, so I am deeply grateful for the advice we have gotten from the Budget Office. Vice President Tennyson and others have been phenomenal in this. So this is the breakdown. The ask was for the $45 million, and we have grouped it into 4 different categories. Number one is the healthcare workforce shortages, and that includes enrollments of the healthcare trainees, not for the medical school, but for the other health science schools, primary care residencies, this is for medical school, scholarships for all, simulation, similar to we have in the HSEC, the MSIM, for these. For the second bucket, which are the inequities, we have been focusing, again, guided by that feedback, guiding by that stakeholder engagement, to develop a better curriculum focused on underserved and rural communities and the knowledge that needs to be done for this. Understandably, stipends for these trainees, and especially, and I like the specificity and the concreteness, it's for transportation there, housing there. I cannot tell you how many times we have gotten everything fixed except for the housing. And the housing is a tremendous sort of catalyst for people to actually do this. In the third one, this is the quality care close to home. It is really our focus on expanding mobile health, expanding telehealth. That is, what keeps you at home if you are sick. And launching with Dean Mulgard, the One Health Clinic, that combines the veterinary and the human care. And the last bucket is the innovation, which is focused on, again, the distributive model is so important with AI and the Learning Health System Center that we started with School of Public Health. I see the dean over there. And what we have accomplished with the renewal of the CTSI grant, which is essentially innovation, how we put it into the hands of the people in the community. These are the foci of the last bucket. Again, I am very grateful to AVP and CFO of the Office of Academic Clinical Affairs, Beth Nunnally, to Julie Tonnison, to Corinne Zierers, because they were really the ones that put the spreadsheets, even overnight, till this morning, in front of us. It's true. Okay. And we have the details. We have paid the appropriate level of diligence and description, to these parts. And now I will turn it to Melissa to learn how we will advocate for these initiatives with our state legislature.
Thank you. Thank you, Dean Toller and Chair Wheeler and Regents for entertaining us. I miss passing to the next slide, but here's the breakdown as well that we just discussed. And our job in government relations is to share how this is going to hopefully be funded at the legislative level with our partners. So for our advocacy plan, we don't just flip a switch. We are ongoing working on engaging with elected officials at every level of government, local, state, federal, and also in community stakeholders, right? Industry stakeholders and so forth. So our work is always to build and sustain the relationship with all elected officials at those levels of government, and we strive to build support for our legislative ask by also having third-party validators. So it's not just government relations, a small and mighty team as we are, but we also have to activate others to speak on our behalf and help us to spread the message of why it's so important and critical for us to fund this request this year. So we work with trade associations and advocates to support the university. Some of them are listed here. The relevant stakeholders in the health sciences space, not just hospitals and doctors and nurses, but also folks like Greater MSP, folks like Minnesota Business Partnership, like people who really rely on us to provide workforce in the state, in the health sciences world. And also with folks in the 6 health sciences schools. So we are unique, as it was mentioned earlier this morning, about how the University of Minnesota has 6 health sciences. So we have public health, veterinarian, we have vet med, dentist, and nurses, and pharmacy, and I'm mixing public health. So I want to make sure that we always remind ourselves of those 6, and I'm still in training. But it's an important strategy to really showcase that we are unique, and we have this unique way of interdisciplinary work in this space. So we should be having the state support and a strong support in that. So we regularly showcase the university ongoing. We bring people to campus, we bring people to collegiate sports, and all of this is to build and sustain relationship. It's not a transaction, give me $45 million and I'll save healthcare for the state, but really do it in partnership and understanding how valuable it is to expand these programs that we have just highlighted. And we can't do it alone. So that is why we also engage with these other really credible organizations in that space as well. So We're regularly communicating with them, we're regularly bringing them to campus and going to them where they are at in community. So that is part of our strategy. We are certainly, this work, like I said, is already underway, and it will be even at earnest even more after the election when it's been settled and who's going to be committee chairs, who's going to be governor, who's going to be in our federal delegation. We're treating them all the same in terms of the same level of engagement and rapport. But at the end of the day, there are going to be certain decision makers that we will have to work through in the administrative process of getting the bills through the legislature. So we're waiting for those dynamics to settle. And then, of course, we're going to continue to finalize our messaging. So we're working with public relations partners. It was mentioned some work that Thunheim has done. We've done work with other of our trade associations like AAU to really reach and understand how we're perceived, what are our strengths, what are our weaknesses, and how do we really fill the gap in what people need to know that we're doing. It's great that we're doing so many innovations and we have so many points of pride, but if we don't share them, no one's gonna know. And we still have a lot of things to be proud of, not just from decades ago, but just, recent accomplishments. And we can certainly work with our communicators in every single department and deans to make sure that we elevate those stories and we bring what I call real people to the legislature, not just us and administrators, but also students, also alumni, people who have benefited from whether it's a cure, a treatment, innovation from the university. So that is all that we are continuing to grapple and make sure that we have the best stories that we can share. And we're getting really good reception. Our legislators are showing up. They love it when we invite them to inauguration. They've had a great time to really showcase the culture here at the university, how important we have connections all over campuses. So all our campuses are extremely important as well, and working with each chancellor to host some of these meetings constantly. We have some underway this weekend with our federal delegation. So we constantly have that, and we want to make sure that we are supporting that work. And then we can't do that alone. So we are empowering all of you as well with those stories, and we will get those refined. So you as well are part of that story and narrative in your respective congressional districts, but beyond that as well. So deans, chancellors, faculty, students, alumni, all of us together will share our stories, share our message about the importance of this work and how we can continue to be innovators and at the top in the health care system. And this is separate from, as you all know, that we distinguish of all our Fairview negotiations. And the legislature knows that. That is ongoing, and certainly this is what we need now to continue to move the needle in this space as we grapple with future decisions. But certainly this is something that is super important, and the legislature is expecting it. We've been communicating with them all last session that we are going to be coming with the health sciences plan. So we've already socialized this with legislators and are expecting feedback from them. So this is a partnership, and I stand for any questions about the legislative strategy, but also we will turn it back over to Dr. Toller if there's any questions on the rest of the presentation.
Great. Maybe I'll start and then I'll invite others of the committee as well. So thank you. So what we heard a lot of both from the legislators and I think Dean Delaney, you and Dean Toller and I on the governor's task force heard a lot about we don't exactly know where the university is going. We don't really understand where the investments are needed and where they are going. Can you just tell me how much does this help? Because I think, first of all, the strategic plan is something that it's really pretty. If those of you who haven't looked at it, I mean, it's really got a vision, got key initiatives, got what levels of investment, a high level or a higher level will do, got measures of success. It's really put together well. How much does that help us? And what have you heard, initially from the people who are out there? I know you've heard things about what we need to alter, and some alterations have already been made based on stakeholder feedback. But how much will this fill that gap of people not knowing actually what we have and where we're planning to go?
And I could start.
And how it serves.
One of the things we've heard from stakeholder feedback, and I'll go back to the slide where this is our ask, these 4 pillars, is that we have a really strong presence in the healthcare side and what health means to Minnesotans, and that's a really winning message for the university and a university academic health system as well. So we already are starting with a positive reception of where we are in terms of our perception in the community. In terms of more on the stakeholders that are more in the industry side, they're really critical of us in terms of what does this mean in terms and giving us feedback, and we're incorporating that feedback in a positive way. So we're having a real genuine conversations, and I think Dr. Toller can elaborate with the work that Thunheim has done under his leadership. But the legislature wants to fill these buckets, wants us to give more specificity, what that $22 million for class sizes increases. And we have that information, as has been mentioned, and has been fine-tuned by our finance folks. And that's really helpful because we're not asking for a blank check. We're asking for this is what's going to move the needle, and these pieces of the interdisciplinary work that we're going to do into health sciences, and explaining that to legislators one-on-one. Healthcare is complicated for legislators too. Not all of them are really in this space, so we have to make the message simplified as well and find champions for this. So when we know who they are, they've been working with us, they have been giving us feedback, they have been going to the hospital tours, so we've also showed them this is the gaps that we have in the system, this is why we need support in this place or the other. We just had a tour just yesterday in the St. Paul campus on the vet med side, and that's how we're going to get them to understand what these numbers mean, is by show and telling, right? Telling them, but also bringing them to campus and really see how this work comes alive. So that's some of the things that we're doing. Dr. Toller, I don't know if you have anything to add.
Madam Chair, if I may, that was very eloquent and very complete. I would add to this that the criticism that we receive is, in my opinion, a sign that the people in the state care. Because if they didn't ask and didn't criticize, they would not even bother asking. So the criticism, as always, has been enormously helpful to us. And I take very personally with our team, and that's the team of all health science deans and chancellors in Duluth and in Rochester and elsewhere, is that we owe it to the state to explain ourselves better. And this group, this committee, has been incredibly helpful in guiding us into how this is done. The second that we have heard is almost unprecedented support for President Cunningham and for her message of considering health broadly across agriculture, economy, reimbursements, and of course the health sciences parts. And that combination of what we have built already over the years and decades at this university and the new leadership, I think, is what gives the energy and excitement to the whole discussion.
It's great. Thank you. Well, and the degree, I have to say, the degree of clarity and specificity that this plan entails seems like light years ahead of at least what I was seeing, presented last year. So thank you. Yeah. I will go to Regent Verhalen.
Mr. Wheeler, you already shared a lot of my appreciation that I was going to share, so thank you for more detail around this. I have just a couple clarifying questions, and one of them relates to this slide. When I talk with people about academic health or healthcare, they immediately think doctors and miss the rest of the picture. Six schools of academic health, lots of sub-practices within that are so important, especially in greater Minnesota communities, vet med, nurse practitioners, dentistry, those types of items. So when we look at this is across all of the schools, this is across all of our campuses, focusing on the healthcare support industries, correct?
Yes.
Okay. I just wanted to be really clear on that.
Can I say something to that?
Please
Which is-
Please,
Oh,
please, President Cunningham.
That guy.
So, Madam Chair, Regent Verhalen, so, and the details, as the Dean said, are there and are beneath this, but the funding for this goes, and we've been very clear on this all along, the funding for this initiative is spread across all of our schools, because all of our schools have a part and our campuses for specifically for Rochester in this. So this is not a medical school funding, this is a funding for the schools all across, and I think at some point when the detail is coming up that I know the team has, you'll see that clearly, and we'll make sure that gets articulated.
Yeah, and I really appreciate that, because I think it's really important to understand that it's not a single focus. While health is the focus, there are a lot of different aspects of that. And then one item you mentioned, Dean Toller, that I wanted to follow up on is you had said the task force members expressed interest on receiving updates on what's happening. We talked about this a little bit the last time we were all together, but with the task force being released into the wild, what conversations have there been about following up with the task force members? If there's been any opportunity to maybe have Chair Malcolm pull everyone together on an ad hoc basis if they wanted to attend a session, kind of what's been that communication?
Madam Chair, if I may, Regent Verhalen, excellent question. I'll briefly comment on the first part because it's so important to me. The physicians are a small part of the team. Everything that we do here, urban and rural, is a team of all these professionals. And in addition, I would add the increasing importance of APPs and PAs in the system. Most of these places that I visited are actually run not by physicians, necessarily, but other parts of that ecosystem. So I absolutely, support that. And in fact, when you would be able to look at the, numbers behind numbers, you will see that medical school is very small part, of this ask intentionally to elevate this. For the task force, I have always respected chain of command. This was not my task force or presidential. This was governor's task force. So I cannot call it or cannot. So what we decided with the president and provost and advice from Melissa Lopez-Franson was that we connect parts of the individuals on the task force. So Thunheim, spoke with Jen Malcolm. I spoke with Jen, at the inauguration as well and afterwards. And then I reached to several players on the task force. Dave Herman of Essentia, Megan Walsh from Hennepin, and Dr. DiCaprio. She has an independent practice. And some of that feedback came from this. And then we split this with Melissa, and she is the one who connected the 4 legislators. And Madam Chair, maybe she can comment on that part.
Thank you.
Yes, thank you, Madam Chair and Regents. The work has been to continue to communicate with legislators, and not just those on the task force, but those on the Health and Human Services committees, those who are more likely to understand what we're asking for. And I say that because, again, this is a committee that I often describe as Health and Human Services because it's a complex area. So not a lot of legislators want to necessarily go into the detail, and we need them to. So we start with the committee members. And even higher ed, not all of them serve on Health and Human Services. So that's a piece. And some of this goes into the ag area as well. So we are targeting the appropriate folks who need to know and who we want feedback from early so we can adjust. And that's also to say that when we do have bills, those do get adjusted as they get through the committee process, and we get feedback more broadly from communities. So we're trying to make sure that we're packaging it the best way possible from the beginning. But also this work has been happening for over a year. So we're getting a lot of good feedback from folks on what they expect and what they need. And the health sciences plan and the justification of why we're asking for this is already in progress, if not almost done. So that is, we're getting ready really closely to deploy to the rest of the legislature, but that's still ongoing.
And just to follow up, have you had specific feedback from those who were on the task force? Like Liebling, Wickland, any specific feedback on this? Yeah.
Madam Chair, on this specific project, or what you're seeing today, we have not. This is, you're getting the first view of it.
Okay.
And getting your reactions, but we will. We have reached out to them. Some of them were here for many hours in inauguration. So Representative Liebling, we've been having a lot of good conversations both here on campus and in Rochester. So I know the president was there not so long ago and interacted with her. She's a champion. She understands this area pretty well. Senator Wickland in the Senate, Rohamu Noor, who's a representative who represents our district, also carried the bill last year. So we're engaging with them. They have the strategic plan that you all saw before today. They do have that. They've had that for weeks now. But now we'll follow up with this level of detail and get
Terrific.
further feedback.
And one of the reasons we were waiting till December was just exactly for that feedback that Provost Croson and others talked to us about last meeting. So I'll go with Regent Johnson, please.
Just briefly again, and thank you of this task force or this whole group. I think of this as a task force too, actually. This is really a high point of where we've been at since this was formed, and we're very excited to be here to thank everybody for their work. This is a great presentation that's put together to look through, and then maybe our next phase can be the snappy video that we can take on the road as well, which is really great. I do hope you'll fully employ all the regents in this. I think that's really important. Some have expertise professionally or business-wise, all in different communities, and I think that's really important. I think we can be really helpful in that. Tina Liebling is my neighbor a couple blocks away. I had a great conversation with her at the inauguration, but we'll continue that in the neighborhood as well. But I mean, everybody has an opportunity to help on this, and so I'm sure we'd all like to be part of it.
Bring her a pie.
A pie, okay, we can do that.
What kind?
What kind, yeah. Regent Turner.
Thank you, Chair Wheeler. I have a question about the big numbers there, and I've heard you all say that you've got it all tuned down to the last dollar, because my observation with the legislature, the more they don't want to shell out money, the more they want it down to the last nickel as to where it's being spent. What I would think would be helpful if I was talking to individual legislators, let's just say number 4, the 10 million, translate to new in communities. Will there be a way to say to a legislature, yes, some of that 10 million is going to go in your area that you represent, either be through the school, or I just think the more we can the more we can be able to use those numbers to show them that they're going to be a part of these dollars, that would be a really strong talking point. Just like when I spoke when the Morris inauguration, and the representative was a farmer. And as soon as I knew that, I brought up the whole lack of veterinarians that we have. See, you have to be able to have that personal connection, and especially with the dollars. It would just really be helpful if we could be able to demonstrate that. Now, that's a lot more number crunching, but you can do that, right? No. Do you see where I'm getting at? Go ahead.
Yeah, Chair Wheeler and Regent Turner, and my team may kill me for this, but I do think there is a way for us to talk, at least in broad brushstrokes, about how, if we implement this plan, what it will mean across different components of Minnesota. The level of specificity exactly for that, I'll leave to my team to not overcommit. But this certainly will, this plan will help Minnesota as a whole, and I think we likely can figure out a way to talk about how, how by doing this it will impact at least different sections of the state, potentially, or in broad brushstrokes, and we should try to do that.
And I would say, Chair Wheeler and Regents and President, the telehealth programs is one that's highlighted there as a third quality care close to home. That impacts the entire state. So I would say that those are, broader strokes, but then we do highlight the Rochester campus because of their work in health. So we will look for every opportunity to connect the dots to their legislative district.
That's all I ask. Thank you.
Lastly, before we start to close this out, I'll go to Regent Gibb.
I'll be quick, thanks, Chair Wheeler. I just want to say I love this plan, and I love one word in it the most, and that's all. I mean, so oftentimes we don't think about the state as a whole, and some of our areas get forgotten, but everybody's a part of this plan, and our legislators are from everywhere, and so they can buy into this too if we can really get to the all. So thank you for that. So I really like it.
Thank you, and I know that between now and when we approve in December, there'll be more stakeholder involvement. We may learn more, maybe modified more by that. I also wanted to ask, and Dean Fuller and I have had a conversation about this. So I looked back at the governance questions we asked strategically back in June from this committee, and many of them have been answered. So thank you to all of you who have done so. What is yet an open question, or an open understanding anyway, is how the care part fits together. So what does the university need to govern? Who will it collaborate with? What programs will we focus on? What does it mean for facilities? What does it mean in an economic model to support that? And that, I know, partly is shaped by the ongoing negotiations that are occurring. But Dean Toller wanted you to say, so these have to come together. Those are the questions that remain that we asked back in June that are unanswered. So how do these come together?
Madam Chair, this is a fundamental existential question for the university, of course. And we are ready to, as we, I think, mentioned at the last meeting, to, by the end of the year, to have the interdigitation of these plans. I want to be a little more specific, though. Taken from the President message to govern our mission, you know, that's exactly what we are doing. I'm grateful to the General Counsel Peterson, for Special Advisor France, and, you know, and others, you know, on our team that are very intensely involved in the negotiations. I have spent whole day yesterday in the Fairview board retreat, you know, on the strategy. You know, we are meeting with the leaders as we go forward. But the bottom line of that is that we need a partner, or need partners, plural, in the ecosystem. We are ready to be good partner to the players in the ecosystem. And we will need to connect this strategic plan to the fundamentally business decision, not political, not legal, but a business decision that will guide our healthcare relationships.
Great, thank you very much, Dean. And so by the end of the year, those coming together will be profound, and it's a profound service to the whole state, hopefully. But I think that President Cunningham said, and maybe you don't say now, we want to get this right. This is so critical to the lives of so many Minnesotans. We have to get this right. So to get it done fast versus getting it done right, we would choose the latter, I would say, is what you have promoted, and I think appropriately so. So thank you. All right, great. Okay, with that, we'll move on to the second agenda item. So we're really going to look at the overview of how this university participates in its various campuses in health enterprises. Today, we're going to focus on Duluth. So our second item is to hear an overview of the healthcare education initiatives, the strategic partnerships, and opportunities at the Medical School and College of Pharmacy on the Duluth campus and the surrounding area, including how the university is serving rural Minnesota and its indigenous communities. I'll note that this is the first of a four-part series that we have planned for this year, where the special committee will get a holistic view of how the university is meeting needs across the state through existing clinical training pathways and new investments in educating the future healthcare workforce. So joining Vice President Toller to present this, our Chancellor Neese, welcome. From the Duluth campus, Kevin Dybel, the Regional Campus Dean of Duluth Medical School, welcome. Amy Pittinger, the Interim Dean of the School of Pharmacy, welcome. And Vice President Toller, would you like to get us started on this item as well?
Thank you, Madam Chair, Regents, Madam President. We are pleased, of course, to have the opportunity to begin our conversation about the health sciences across the whole system. This is how it starts. And we will start with Duluth, which is really exciting, isn't it, Charles?
I think so.
Okay. And
We're glad.
And I will, you know, start framing this by saying this is what we are about. This is what land grant means. You know, that we are serving all the parts, to Regent Hibb's, you know, comment, you know, previously, all the parts of the state. Now, that has been perennial. What is acute is what's happening on the ground, and we heard it. Both of us in the task force, we hear it day in and day out from Regent Turner on the workforce shortages, the access. You know, everybody knows that this is so. It's brought to the sharp focus now for us to really elevate this. And so we start with Duluth. We have had presence in Duluth for more than a half a century. We have a medical school campus there, and for about 20 years, we have the College of Pharmacy campus there as well. So we are known entity in Duluth, and we have been asked repeatedly, our predecessors and ourselves, to increase in both of these fields the number of trainees and professionals in the rural Minnesota in the area of Duluth. So I'm delighted to have Dean Diebel, Dean Pittinger, and Chancellor Neese here today. But it's also important that this is a programming that spans all the health science, not just colleges, but really our presence in Rochester and in other campuses as well. And the goal, as always, is to give value proposition, to give something that matters and have an impact that the people in the region desire. And with that, you know, this is the opportunity for our university to show what we are made of, you know, how good we are at what we do. And it is almost unbelievable how enthusiastically has been, this discussion received in Duluth, and I'll come back to this at the end of this presentation. But I'd like Dean Diebel now to start with the medical school update.
Thank you so much. Thank you, Madam Chair, Regents, Madam President. It's a real privilege to be here with you today to showcase some of the things that we're doing at the med school, where we're going, and I'm privileged to be here with my colleagues from pharmacy and UMD as well. I have a few slides on the Duluth campus of the medical school. So in the late 1960s, there was a big movement around physicians across the state, but particularly in Duluth, to try to advocate for a new campus of the medical school to be located somewhere in the state. It ended up in Duluth to be able to address the rural physician shortage that was looming across the state. And so in 1969, successfully with a partnership with the Regents and the state legislature, we were able to secure $300,000 to start the process of opening a campus in the Duluth community that officially opened in 1972. With a focus to train physicians for rural communities centered primarily around primary care. Family medicine was a focus for sure, to be able to try to address those shortages. We started with 24 students in 1972. We're proud to have 65 students per class now in our campus as we've grown over the years. And 50% of our graduates practice family medicine, and the family medicine department of the University of Minnesota Medical School is ranked #1 nationally. We're also proud that over 2,000 graduates have come through our campus, and about 2/3 of them practice in Minnesota, and over 40% practice in communities of 20,000 or less. And we're poised for some changes. We have just successfully gone through the process of informing and getting permission from LCME to move forward to an expansion from a 2-year program to a 4-year campus. We received word from them in July that they had no concerns with the process. When they come for our full site visit in 27-28, they'll be looking to make sure that we have the clinical training that we are building to support our students in this process. Now, in order to go through this change, a couple things have happened. We have shared the curriculum with the Twin Cities in a meaningful way for the first time ever, starting last fall, which has created some structural symmetry to provide us the ability to have the capacity to go through this expansion. So this is our served curriculum that we've gone through. And then we're going to go through this process by leaning on 3 things that already exist. One is the Rural Physician Associate Program. This is RPAP. That's been around since 1971 to ensure clinical training of students in rural communities takes place in a longitudinal manner for a significant portion of students at the medical school. Right now in Duluth, about 20 to 30 of our students participate in that program every year, and as part of this expansion, we want 35 of our students to participate every year. That's our target. Additionally, we have partnerships with Essentia and Aspirus in Duluth to do more traditional block rotation training. There are 10 slots available for students currently. To make this happen, we're looking to expand that to 30 by the spring of 2027, and we're excited to say that we have about 15 to 20 slots available right now for the spring of 25 as we're on that trajectory to ramp up. So one of the things that we think is really important about this process is that not only are we recruiting students to train in rural communities, where students train also is a predictor of where they'll go on and practice in the future. And over 40% of the students that have participated in the RPAP program go back to serve in rural communities when they're done with training. And then finally, the other component of our campus that's been a part of our mission ever since its inception is a focus on Native American healthcare. And we want to continue this focus on Native American health as we move forward into this expansion. We're very proud of the fact that since 1972, our campus has graduated the second most physicians of Native American heritage in the country. In the 1980s, the Center for American Indian Minority Health was established to be able to support these trainees as they go through their process, and we're very excited that we've opened a second center in the past year in the Twin Cities to help support students of Native American heritage and healthcare programs here as well. And we want to build on some of the programmatic success that we have in the center, like the Native Americans into Medicine 7-week intensive program, where we bring in undergraduate students into a program that's supported by the center to really show them the pathway and decrease barriers, increase opportunities for them to be able to engage in health sciences training in the future. So we look forward to continue to build on that as well. And from here, I'd like to pass it to
Thank you. Chair Wheeler, Regents, President Cunningham, I'm happy to have a few minutes to tell you a little bit more about our Duluth campus. The College of Pharmacy is one College of Pharmacy, but it's across two campuses, the Twin Cities and Duluth campuses. And we are the only pharmacy school in Minnesota. With the help of our community leaders and partners in the regional healthcare systems, we did open our Duluth campus in 2003. And this was in response to the profound shortage of pharmacists in our state, particularly in Minnesota's rural communities. On our Duluth campus, our mission is to educate pharmacists to promote the health of diverse populations in our state's rural communities. And we also aim to increase Minnesota's pharmacist workforce, but again, with a particular focus on the rural communities. So we recognize the opportunity to recruit students and from and return pharmacists to Greater Minnesota. Since 2007, which was our first graduating class since our Duluth campus opened, 940 Duluth students have graduated as pharmacists. And we have alumni from our Duluth campus in 71% of Minnesota's counties. As the university's health sciences strategic plan moves forward to implementation, we recognize great alignment with the plan's goals and those of our whole college. When we consider our Duluth campus in particular, there are a number of specific opportunities, and just highlighted a few of these on the slide. Our goals for community engagement, research concentrations, and strong partnerships all put us in a position to join in the strategic plan's mission to foster a healthier Minnesota through education, accessible care, innovation, and partnerships. With that, I will turn over to Chancellor Neese.
Fantastic. Thank you, Chair Wheeler, Regents, President Cunningham. Super excited to be here to talk about this partnership with the University of Minnesota. And to your point, Regent Verhalen, thinking about healthcare broadly and not just training doctors. But we do want to say that we are helping to support the training of doctors. And so the fact that the medical school is on our campus, partnering a lot with Dean Diebold to make sure that those scholars feel part of the campus community, feel connected, feel supported, are able to use the gym and the rec center, and with the expansion of the four-year program, how we look at the way that we might be able to support them through housing and some of the needs that they will have in that space. And so our constant work with and support of that is critical for us, as well as some of the support that we do through that pre-pharmacy pathway to support that continued ongoing commitment to educating pharmacists and bringing that together. The university has a huge pre-health program. A lot of that, again, is those students who think that I'm going to grow up and become a doctor, and making sure that we are providing that pathway through a lot of our academic programs and our pre-health advising and care that we provide for that. But beyond that, we're also looking at that broader healthcare system and the different ways that we can support that. Just last week, Provost Carson brought some of the deans from the Twin Cities campus to Duluth. We spent a lot of time talking about pathways and those partnerships with the University of Minnesota Duluth and those graduate programs here on the Twin Cities campus, and how are we helping and thinking strategically about different ways and different pathways that we can increase that. We already have one of those set up, and that's working really closely with Dean Delaney in the School of Nursing, which is a pre-early admission already in the junior year for a master's in nursing. And so students in their junior year at University of Minnesota Duluth can already apply for and get early admissions into the Master in Nursing program in a way that partnership really helps that. We also have a program set up with the Twin Cities campus around medical lab science. And so students will do 3 years at Duluth and then come to the Twin Cities campus for 18 months to get their degree in medical laboratory science and supporting the healthcare industry around that piece. So all of that is part of the way that we're already looking at how we partner with the Twin Cities and helping to increase pathways to all those healthcare areas. But also on our own campus, we offer the Bachelor's in Business Administration and Healthcare, recognizing that healthcare isn't just about the clinicians, but how do you operate and manage that program. In a similar way, we offer an executive-style MBA program on the University of Minnesota Rochester campus that allows those professionals that want to advance their careers and get that learning and understanding around business administration by doing a Friday, Saturday type of executive MBA program in Rochester, working closely with Chancellor Carroll to make sure that project happens and moves forward. We have a free speech and hearing clinic on campus that is supported through an endowment by a local family foundation that sees over 2,000 patients that come in and get free hearing and speech screening and training, also part of our healthcare system. They're also doing wonderful research around helping vocal training for individuals who are transitioning in their sexual identity and working closely with our trans community, and the important research and work that is being done in that space is happening in this free clinic, and so really important for us. We also have a great program working with the Regional and Tribal Child Welfare Center to do certificate training program for all social workers to make sure that they are doing and providing that child welfare care and understanding our tribal communities and how they support the culture and identity of those communities. As well as our computer science program has developed robots that have been deployed in nursing homes that are doing intervention care and strategy around early onset dementia. In different ways that a robot can actually provide some of that ongoing training and support. So all of that is work that's happening at the Duluth campus that expands, and the increased presence of medical education there will only elevate some of that great work. I'm 100 days in, and I think almost every one of those 100 days, someone is asking me in the city, how is healthcare going? And how is the medical education program going? And that includes our partnerships with the hospital leaders, our partnership with the tribal leaders who have asked me these questions, elected officials, as well as a partnership that I've developed with the superintendent of Duluth Public Schools to work with K-12 to increase the pathways into healthcare professions and what that might mean. So we're super excited about this partnership and what this might mean for Duluth, but more importantly for the state of Minnesota as we address health, broadly speaking, in the state. And with that, I turn it back over to Vice President Tola.
Madam Chair, I'm so grateful that you are so excited here. When you started on the free speech, I thought that you're gonna go to First Amendment. But, it's free of charge.
Yes.
So as you of course heard, all means all health science programs that we have, the connection with other system, campuses, and I'm not gonna read the previous slide, actually. And I'll just say that the common denominator of people who are interested in healthcare, in my experience, shared and referred, is honesty, hard work, and helping others. And it doesn't really matter what kind of profession you take within that clinical team. It actually is the glue, the psychological and professional glue that we all share. And Duluth, has been, one of the greatest examples that I have seen at this University of Interprofessional Education and how we can connect these programs in a much more seamless and practical way. This gives me an opening to share with you the last slide, which is on the Duluth Academic Health Project. So this is a pride point, and I think that it is a vague and empty phrase unless you are actually in Duluth and you can talk to people who live there, and how much of the magnetism of the University of Minnesota can be transferred there just by virtue of having a building or a center. That has been the idea behind the Duluth Academic Health Project. The ability to connect with the health care systems there, the ability to create jobs, the ability to create something that is a nucleating factor has been present for some time. We started in 2018 when this board asked for a study to look at how College of Pharmacy and medical school campuses can actually help and collaborate better on what we are talking here about, which is the value that we can create and the value proposition that we can present to people in Duluth and the whole region. And there were some stops and spurts and back and forth, and now we have landed it on a capital request for the 2026. And there's a lot of work that is gonna now happen. So the first change is, to your point, it's all health science schools and Rochester and Duluth. It's not just the pharmacy and medicine that was considered in 2018. It's really much more holistic and much more all-embracing work now. The second part is that the internal work, will happen on a very rapid timeline. So we have now been able to work with the Capitol Office and figure out how to go about the needs and about the financial capacity of the potential tenants in that building, because that will determine what it looks like, that will determine how much it costs, and that will determine how we're gonna go about the ways and several scenarios that will be important for your consideration. So the first deadline is end of October, when we will consider these needs and the financial capabilities. By December of this year, we will work with the President's Office, Jamie Larson and others, and the Budget Office, of course, to develop an outline of pre-designed costs. And then we will move fast through the year, through the internal, external work, some stakeholder engagement, of course, as always, continuation of the stakeholder engagement, so that we are able, about a year from today, in the fall 2025, to come to this board for further discussion. So what I think, what I can be a humble messenger to you for is how much excitement this triggers. So we talk to the community leaders, to the local legislators, we talk to the CEOs and the leadership teams of both the healthcare systems. There are independent hospitals in the area as well. The mayor's office has been very interested in the Chamber of Commerce. And in fact, I am told that the Duluth City Council is considering a resolution to support this Duluth Academic Health Project in a day or a week. I have no governance over that. And so I'll end up on saying this is very good for the university. This is very good for Duluth. This is very good for the mission that we serve here at this university. And coming all the way back to where I started, this is what land grant, service, and commitment is all about. Madam Chair.
Thank you very much, Dean Tiller. Thank you very much all. Let's go, oh, yes, President Cunningham, please.
Yeah, Chair Wheeler and Regents, two things, and then I would like to ask Jacob to elaborate on something as well. I mean, one is, I am also finishing my first 100 days here. And I was very excited to see this presentation because one of the things I saw as we were thinking about our other goals as a university is this is one of the most beautiful examples of systemness that I can bring to you, right? So, you know, this is not a campus issue. This is a University of Minnesota contribution to the state and to the region by these intercollaborations, which actually have existed for many years and are working very well and are serving our students in a pretty seamless way across a number of campuses. And so as we have future conversations about systemness, it became clear one of the things we need to talk about is all the ways in which we are already operating actually quite well as a system and how our campuses are already quite a bit bigger than the sum of their parts and serving our students in the state in that way. So for that, I was very excited. The other comment here is it's hard to overstate what it means for what the dean said here in terms of the ability to move from the 2 to 4 year program in Duluth to meaning that people will be staying there and then fully encompassed, and not coming to the Twin Cities, and what that will mean for them being able to stay and practice rural health. And I've been reminding the team, we talk about numbers of 30 or 50 physicians and things like that a year, but remember those, if you multiply over 4 years, are 200. So in 5 years, it's 250 people you've trained. And by the way, I mean, we have long careers, or we try to have long careers. So then that means thousands of physicians trained that will likely stay in these communities over decades. So I know our deans and our schools tend to think in, which is rightly so, thinking in annual near numbers. But when we think about population health and population impact, we have to think about like the thousands of people that will then have a career life trajectory of work in the state for 20 years is a lot of people. So these small number increments are actually quite large. And then Dean Toller, and it may be very obvious to many people, and maybe everybody here has heard a lot about it, but could you just take us up a level for this last project and say, you know, what does success look like on it, and what is the ultimate kind of top level goal of the academic health project? Because it's, you know, it's rolling around and I'm walking into it in a time that has been building, and maybe other people have seen different parts of it over time, but just can you just take us up a level? You know, why are we doing this, and what is it going to look like when it works great?
Madam Chair, Madam President, excellent question. I will, start with the fact that this is one of the ways this university can be not, you talked about how it serves Minnesota, and of course, where we start, that's why we are land-grant university, but our ambition is national and international. This is a way of demonstrating how we can serve, in ways that the RPEP program has been adapted nationally, internationally. This is what people say is a Minnesota model, that you get the people who want to be in healthcare from the rural areas, you train them there, and they stay there. It's a tourism, it's obvious, but we were the first, this university to do that. So that is the first component, what success actually looks like, that we built on the legacy that we have created here. What the other thing is that the people who will stay in that region will be imprinted by a different training that one gets at a different university. That's that innovation, that's that commitment to service in the communities. And you will carry this, as the president said, for decades of your profession. Then the glossy, beautiful vision of this being a success is a building. First of all, it's an anchor image, that the mayor of Duluth, the community, the chamber, even Charles, wants, to see, because that is how you build something similar in a way, like the HSAC that we have built, here some 3-4 years ago that Provost Crossan and I have a privilege to serve. So it is an anchoring part, of the ecosystem there. And its functionality is in the training, as you said, is in the excellence in the innovation, and it is in the numerical advancement of the number of health practitioners across the whole system. Madam Chair, Madam President.
Regent Aaron.
Yes, just some clarification for me, and I will apologize for my ignorance in this area. But in hearing your presentation and in looking at some of the slides, it'll talk about the College of Pharmacy or the medical school collaborating with UMD. And to me, the way I think of it is both of those are within the University of Minnesota Duluth, but you talk about collaborating with the University of Minnesota Duluth. So could you, it almost sounds like they're two separate entities, and I don't think they are. So can you clarify that for me in terms of how to think about the role of the College of Pharmacy or the medical school vis-a-vis the whole UMD system or campus?
Yeah, Madam Chair, Regent Marion, great question. And I will rely on my colleagues if I get this wrong. It's an interesting piece. So as the students are admitted and start their program, they count in University of Minnesota Duluth enrollment numbers, but they don't count in my graduation numbers because they are graduates from the medical school, which is a system-wide medical school, and the School of Pharmacy, which is a system-wide college of pharmacy, right? And so I think that that's where it is about a collaboration, because they're not, the schools themselves are then more supported through the colleges and the deans that are located on the Twin Cities campus as far as the curricular oversight, and the faculty are technically then faculty of the Twin Cities and the medical school that is based in the Twin Cities, and the College of Pharmacy that's based in the Twin Cities. So I think that's where that word collaboration comes in, is because of that role of, so the accreditation for the medical school is for the Twin Cities Medical School, that is allowed to be part of that almost like satellite campus, if you will, that is on the Duluth campus. So did I explain that accurately? Yes?
Madam Chair, Chancellor, I will just add to this that Duluth is Duluth. You see, these distinctions, between the system campus UMD and, within the same building, essentially, our College of Pharmacy and Medical School is for our internal purposes. For people who are there, they don't see that. They see it as as one, and which we are, because Charles and I, and with Shashank Priya, the VPR, we are working on a number of classes, for example, that span Swenson College and the medical school campus. We have a number of these efforts already in the pre-health environment, and that is going to grow. Madam Chair.
Our president has a comment. Please.
Madam Chair, another way to think about it is, because I struggled with this a little bit too as I'm coming on and trying to understand. So, we have these satellite locations. In some ways, it's an excellent that we're not duplicating administrative structures needlessly, which we would then have to have a peak project to undo. So, we don't need duplicative administrative structures, and so the administrative home, which is the behind the scenes part, that helps administer these components, resides for accreditation, so we're not having multiple accreditation processes and all those other pieces. If I get that exactly right, and maybe not, but I think to the point, especially as now the students that they're talking about will stay all 4 years, and they are housed and working, they feel Duluth branded, and they are working with the Duluth community and will likely stay in a Duluth community. Where their accreditation comes from is a little bit of an afterthought, and is in terms of the budgeting. So I see that as an efficiency we have here, that we haven't duplicated full medical schools in places, and instead we have an administrative home and we have satellite campuses, and those campuses sit in a way that makes our system better, because we're using the systemness part by using the existing structures we have. Because, and this is true also, at Rochester campus as well, with some of the programs that are in a similar way. We then are using our housing and student services and the other things that Duluth is using to support them, as Rochester is using to support them there, although their administrative home might be in the system. So for me, this is we don't have to peak it.
Just one quick follow-up. First of all, the presentation is great, and it's exciting to hear about what's going on with Duluth and the breadth of it and the expansion of it and the projects. But I will say this is confusing to me. And to the extent you're making presentations to others, it may be confusing. I don't think it matters at the end of the day, but maybe we don't need to be talking at it in exactly the way we're talking about it, which is to deal with it internally, as opposed to what we're saying externally in terms of the role of the Duluth campus and what it's offering in the medical field versus system-wide.
Makes sense. Chancellor Neese.
Yes, and if I just may add, I think part of what we're hoping to be able to say is that you can get your education from kindergarten through MD in Duluth. And that it's not necessarily about whether or not the accreditation comes from the Twin Cities or not, but that we're able to provide that pathway from kindergarten to MD. And that's what the community is super excited about, and I think we'll get behind. So I think you're right that it'll be important for us to recognize that we've got some of these behind the scenes administrative structures that are going to be important for us to maintain, in part because of efficiencies, but that at the end of the day, the story that we're telling is about the educational experience and then the workforce that we're able to create because of that. So thank you for the question.
Thank you. I'll go to Regent Johnson.
Yeah, thank you. Was wondering if this is an appropriate time and place to ask about this, or just a little bit of information. We alluded to that the City Council in Duluth and others are interested, and I know we've had some conversations and learning sessions before about some of the complexities and what the medical systems are. You have Essentia, and then there's another St. Luke's there. Anything that you could say about prognosis, what you think, how you're going forward, what kind of support you have from the Duluth community of all, any of these other players?
Madam Chair, if I may, first, and then I'll hand it over to you, Kevin. The prognosis is good. The patient's gonna live.
I'm sorry, I gotta use a medical term.
Because we have value for either of the systems and both. We have not made a decision to date, whichever, way we're gonna go. There are essentially 3 options. One is on the lakefront, which is between the systems, and the other ones are obviously, part of the location where the 2 systems are. My team is in a very close connection with the leadership of both healthcare teams, and I can assure you that I am optimistic about the prognosis because everybody recognizes the value that we bring to Duluth. Dean Diebel?
Chair Wheeler, Regent Johnson. Just to reiterate what Dean Toller said, we right now have a very strong partnership with both Essentia and Aspire St. Luke's. We're depending on that partnership being maintained as we transition into a four-year campus, and we anticipate no problems in doing so. And it really does come down to, at the end of the day, with lots of planning still in front of us, what makes sense for everybody involved and how everybody can feel like they have a part in this project as it comes to fruition. But concrete decisions haven't been made yet.
And if I can ask, Chair Wheeler, Regent Johnson, just last Thursday night, Kevin and I had dinner with the leaders from those two hospitals. We sat at the same table, we all got along, we broke bread together, and I think that there is this commitment to figuring out how we come to solutions together around this. And there was a great article that ran in one of the Duluth newspaper publications this past week that, again, featured a picture of the leader of Essentia, the leader of Aspira, and Kevin, all three of them in one picture together. And so I think that there is this really commitment to that collaborative spirit.
Can we get that?
Yeah.
Articles, that would be nice to have, we just have part of our understanding. That's
And
really-
they also volunteered to be here today. That's how committed they are. So
Maybe next step, that's great. Well, win-win, sounds like that's great.
Great. I'll turn to Regent Turner.
Thank you, Chair Wheeler. So I have it's probably a pretty basic question, but humor me. So I heard you mention that you want to increase the clinical spaces, from like 10 to 35, et cetera. What stands in, how does that process work? Is it clinical spaces in, say, the Essentia Hospital? Does the Essentia Corporation have to contribute money, and does money come from the federal government? I'm in the back of my mind, I'm thinking dollars, and who do we need to go to other than maybe our corporations who have lots of other things to spend their money on? Should we be going to the federal government? Should we be going to the state government to be footing the bill for some more of these training dollars? Or is it limited because say my own hospital, North Memorial, can only afford to have so many clinical spots. Please, this might be a basic question to other people here, but if you could educate me, and my end goal is to find out where to get more money.
Sure, thank you. Dean Toller. Chair Wheeler, Regent Turner. We have been working very closely with trying to understand how the model in St. Cloud is coming into fruition for their campus that's coming on board. And what we've learned is that there is a bit what they call drag on the system, and being able to provide clinical training in either Essentia or Aspire, or even in Centricare, what they're doing in St. Cloud. And right now what it is that the hospital systems have to acknowledge that this is an extra thing that they would have to take on to make this come to fruition. And right now, both Essentia and Aspirus are committed to being able to overcome what that drag, which is essentially like one patient per day per physician that would be doing the training of our students, because they know that the need in being able to do the workforce development in Duluth overcomes that particular drag on their system. They know that it's more expensive to recruit people into their community to do the training in Duluth than it would be to train their own and get them to retain and stay in Duluth. And without any intentionality, 10% of our alumni actually work in the Duluth area. And it's important to note that 30% of the Duluth workforce is associated with healthcare in one way or another. And so it is an investment. It's an investment in time. It is an investment on the system. It's an investment in recruiting people who want to be physician educators to be able to be part of this process, and it's probably an evolution over time. I know that they tap into the MERC dollars as part of being able to offset some of this cost, and Dean Toller, I don't know if you have other details on how they might be able to overcome this.
Madam Chair, Regent Turner, that was excellent, Dean Diebel. I will just add, that it's not, I refuse to call it a drag, with respect. Because everybody knows, and some of you in this room, you have yourself or loved ones taken care of in environments that have the trainees around and those that not. And most commonly, what I hear is that it's much better care in the training environment. So this, and there are objective criteria to this. The quality and safety is better. Regent Johnson knows this from Mayo. The productivity is actually better at the end of the day, and the retention of the high quality health professionals is much better if you have the trainees around. So it is beneficial to the systems to actually desire this. And part of why Essentia and Aspirus are very serious about the commitment to this is because we will bring the bright and excited trainees to the mix. So we don't need money for that part. This is really on the side of the system. What we need money for is what you alluded to, which is the graduate medical education, which are the residencies, because the physician, learns whole life, but she, has after the medical school the residency of sorts. And that part, we are now, working with CMS, we are working with the state to get that paid for. Thank you, ma'am.
Thank you. Yes, President Cunningham, please.
Chair Wheeler, I might add, it's hard for me to also not hear this presentation and think about what it means for the economic development of Duluth and the region, which to have an expansion like this and to continue to attract more people to the region and keep healthcare providers there and also keep families and rural communities. One of the things we need to keep them in place is good health care. And so there's an economic impact to the region of Duluth that may or may not be easy to quantify, that when we do projects like this really matters.
Thank you. Thank you, President Cunningham. We'll go to Regent Dipsnitz, and we'll just have a few minutes left here, so.
Okay, thank you, Regent Cunningham, for that. I was going to talk to the economic development piece. But to me, that's really important part of what we do, because where there's healthcare professionals, people want to work. And to Vice President Toller's example of Roseau, they make snowmobiles and ATVs up there 20 miles away in War Road. They make windows, Marvin windows. They have a big thing called Lake of the Woods up there that's huge on tourism. So it's really an important part of our state, and that's just two towns we just mentioned. And so if they don't have healthcare professionals, those people will move out. And so it's a given. And so the economic impact is huge. Just in my hometown of Perham, we have a new hospital, and we're starting to get more healthcare professionals. We've invested over $1 billion in things like dog food plants and cheese plants and stuff we all need. So, I mean, this is a really important piece of cog in this whole engine that we call Minnesota. So thank you for what you're doing and expanding rural.
Thank you. Madam Chair, if I can add, you can quantify this. Actually, there are statistics in the state of Minnesota that says that for every physician, there are 13 jobs. Not in healthcare necessarily. Every physician brings about $2.5 million, collectively into the budget. The healthcare force, not just physicians, makes about 10% of the gross state product every year. So this is incredibly important.
Thank you.
Hugely important point, and I'll go lastly to Board Chair Marin.
Well, I just, to make it so that I'm understanding about the funding and based on the question that Regent Turner asked, it sounds like the long and short is, in terms of the clinical spaces, those have to be paid for or are being paid for by Essentia or by St. Luke's. In other words, it's not something that the university can fund, but we need our private partners to be able to provide the funding and ultimately the space within their facilities to address the clinical needs. Am I correct?
This is correct.
Okay, well, thank you so much for the presentation, and I think that, first of all, it's exciting to think that people can stay in Duluth for medical schools beginning with next year, 2025, entering class, the same year as medical students will start at CentraCare. So we're, literally, expanding the workforce that way. And I think that President Cunningham said it best, but, really, this is a model of interdisciplinary care and, and a system, approach to care. So I think that you've demonstrated that very well. So I really appreciate it and all it brings to my father's hometown and the whole state of Minnesota. So thank you very much for being here and presenting us. Appreciate it. All right. With that, I will adjourn this meeting. So thank you all.
I